Welcome screen. There we go. I knew I'd find it eventually. It's in there. So welcome to our presentation this afternoon. I just wanted to introduce myself briefly. My name is Steve Miller. I am the project director for the Mid-America PTTC. And we are so glad that you are here. We are Region 7 of the PTTC. For those of you that may be unfamiliar, the Prevention Technology Transfer Center is a program of ACT Missouri where Alicia splits her time between the deputy directorship at ACT Missouri and working as a coordinator for the Mid-America PTTC. And basically, we're here to build the capacity of the community. And we do believe that prevention is better together. So it's making us stronger when we work together and collaborate. We do have a firm belief that language matters and that words have power. So we do strive to put people first in all of our applications. The PTTC network uses affirming language to promote the application of evidence-based and culturally informed practices. Wanted to let you know of a few upcoming events that we have in case you are unaware. We have an upcoming, what is called a DEC Connect. It's with the National Alliance for Drug Endangered Children. It's called All Hands on Deck. It's April 28th, and I will put a link into the chat here as we get underway. And then we also host a series of what are referred to as communities of practice, and Alicia is actually the host of those events as well. And we have two more coming up in the month of May, and I'll include those links as we go along today. May 16th, the community of practice is on training and technical assistance. And on the 23rd of May, we will have another one for those of us that are engaged in the behavioral health workforce. And basically what a community of practice is it's a led discussion around a specific topic of interest around either TTA or behavioral health workforce. And it's a way to kind of come together with your comrades, your peers, your coworkers, other people in the industry around these areas, and to kind of brainstorm together and to kind of think outside the box and give us a chance to maybe regain a new perspective when we move back into our day-to-day workforce. I think everybody's pretty much familiar with Zoom by now, but in case you're not, please keep your microphone muted if you're not speaking. We do love to see your smiling faces, and it looks like Louise Bigley invited the entire community there to come and see us today. Thanks for welcoming in all of Webster County there, Louise. Use the icon off the reactions button at the bottom if you would like to applaud or raise your hand or anything of that nature, or you can always use the chat function at the bottom of the screen. And I don't believe that we will be doing anything with annotation, correct, Alicia? So nope. We'll skip over that for today. And then the most important thing from my perspective is that we are required to report any and all of our activities to our funder, which is the Substance Abuse and Mental Health Services Administration, or SAMHSA. And while they do support us, they don't necessarily say that what we present in this training reflects their views or their opinions. We try to adhere to the guidelines of all good ethical prevention, but we do want to separate ourselves from the fact that SAMHSA is providing the funding, but we're hosting this event. And the way we track whether or not our presentations are striking a chord with all of our participants, we have you fill out what we refer to lovingly as the GIPRA post-event. And I will put a link in the chat at the end of the presentation, and we would love to have you join us in filling out that post-event evaluation. It's 6 questions. It's totally anonymous. You'll be in and out before you know it. So we would love for you to do that, and we'll draw your attention to it as we get to the end of the session. So we'll go ahead and move on with our presentation for today. And let me introduce Alicia Ozenberger. As I've already casually mentioned, she is the Deputy Director for ACT Missouri. She also is a coordinator for the PTTC. I've known Alicia now for as long as I've been in prevention, right at 13 years now. And Alicia brings with her about 20 years of service in the prevention field. And this was something that she brought up a few years back, actually predates my employment here, that this was something she felt like would be value added for our audience. So we're excited to have everyone here with us today, and we'll go ahead and launch into our needs assessment. Thanks, Alicia.
Thank you for having me, and welcome everyone. It's a rainy day here in mid-Missouri. Hopefully the sun is shining where you are. Like Steve said, I'm Alicia Ozenberger. I've been with ACT Missouri for a little over 20 years. When I was first asked to start developing this presentation, I was kind of baffled because this is a beast to tackle, is community assessment and policy scans and things like that. And so we're doing the 10,000 foot view today. If this is something that we need to dive deeper in, we can pull back the layers and we can have more trainings. That's the best thing that I think the pandemic has taught us about Zoom, is we can all come together and have a quick training, and it's very beneficial. So I wasn't going to do introductions because we had a bunch of people registered, but the most important people showed up. So I will have you guys go around and do introductions, and I will ask each one of you just to say who you are and where you're from. We'll make it quick and dirty. There is a Google Doc that I put in the chat box, and we'll keep putting it in for those who just joined. And that is the opportunity for you to put your name and email address, because we will do a few group projects. And so if you connect with someone, by all means, we want to make sure that if you feel comfortable sharing your email address, then those folks can reach out to you if they want to reconnect with you and ask you a question. So feel free to type that in the Google form as we go. And so I will start with, we'll do Chuck and then Deborah.
Hi, I'm Chuck Doherty. I'm the Executive Director of ACT Missouri right here in Jefferson City, Missouri, and also co-director of the Mid-America PTTC. Thank you. Thanks for coming.
And Deborah, and then Louise, I know you have a bunch, but you're next.
Good afternoon, everyone. My name is Deborah Hampton, and I am with the Cumberland River Regional Prevention Center, and that's in Kentucky. Southeast Kentucky is the region that I cover. And I'm a certified prevention specialist.
Great. And we'll do Louise, and sorry about that, and Justa.
Hi, good afternoon. I'm Louise Bigley. We're with the Webster County Health Unit. This is our health ed team, and I will let them introduce themselves.
Hi, I'm Ashley. I'm Kayla. Stephanie.
Thanks for letting us be here today. We appreciate it.
Good deal. And Justa, and then Megan.
Hey, my name is Justa Thomas, and I am from Kentucky as well. I've actually worked with Deborah before. I am a certified prevention specialist as well, but I took on a new role, and it is called a youth substance use treatment coordinator. And it's a very long name, but this is a much needed training for this new program. So thank you so much.
Then Megan and Yolanda.
Hello, everyone. My name is Megan Dinero. I do apologize for the video. I'm on the road, but I'm new into the prevention world. I have no specialty yet, but I'm 6 months in working here in Laredo, Texas for West Care, and I help with the drug coalition down here. Thank you.
Okay. Thanks for joining us on the road. Appreciate that. Yolanda and then Tanya.
Hi, my name is Yolanda Chatwood. I work with a drug prevention coalition in Nevada, and I'm new to the field, but I am working on my prevention specialist certification.
Okay, Tanya and then Paige.
Hi, everyone. I'm Tanya Brewer, and I'm with the Kentucky River Regional Prevention Center, where I'm the youth empowerment specialist, and I'm also working on my certified prevention specialist as well.
Okay, and then Paige.
Hi, everyone. My name is Paige Ewing. I am actually the multimedia specialist for a coalition in New Jersey, and our hospitals, they do needs assessments, but my job is to try and communicate that then to the public. So I'm trying to learn a little bit more about what goes into a needs assessment so that I can do a better job of communicating that.
Perfect. Okay, let me get to my PowerPoint real quick. I had too many things open. Happens that way, doesn't it? All righty. Hit the wrong button. For those of you just joining, I go on vacation tomorrow, so I'm already in vacation mode. So I'm over caffeinated and looking forward to vacation. So I keep hitting the wrong buttons because I'm super excited to get this going and to get you guys trained and then be on my way. So community needs assessment. So we are going to jump in and we're going to have a group conversation. And I am going to split you guys up into 2 groups since we have 6 people. And what we're going to do is we're going to go in that Google form and we are going to talk about your experience with needs assessment. And if there's no experience with needs assessment, that's perfectly fine as well. But if you've had any experience doing a needs assessment, what I would like for you to do is open up the Google app or the Google Doc. And you will see that we have a question in there, and we want someone to be the reporter and take notes for us. And then we will briefly come back and talk about that. And then we will go on with the presentation, but we're going to see where everyone starts from. So Steve, if you could do 2 separate rooms. The first question is on the left-hand side of the Google Doc. So we'll have 2 groups.
It is actually not allowing me to set up breakout rooms.
Let me.
And I don't know if it's working on your end.
Yep, it is. Okay, so we're going to make this, let's do 7 minutes and then we will come back. Okay. So is everyone able to type in their Google Doc, or at least someone? No? We have it. Okay. Yeah, I think most everyone can. So if someone can't, I think we'll have you covered. If not, let us know, pop out and let us know, but we'll go from there. Okay, so 7 minutes and talk about your experience with needs assessment. See you in a few. I forgot I did a breakout right from the get-go.
I did not join, sorry.
That's fine.
So this is like 7
And then when you started the breakout rooms, it now will allow me to make breakout rooms.
Weird. Huh. I just had to do it first. Nah, nah, nah.
So is this like 7 minutes in heaven?
Yes. Well, 10 seemed too long, but
The group with the Webster County, what number were they in?
2.
What, 2?
yeah.
You
So
wanna
they
join
have
them?
the most people. So
Do you want to join them?
Nope, that's where I didn't join, is I figured there's enough people there.
yeah.
Yeah, Louise works with Scott Allen.
Yay.
She's
Oh,
his
Webster,
County. Yep, that's why I was teasing
Missouri.
her.
Okay.
Yep,
Yeah.
she is. She's Scott's health educator / second what be in charge, I think. But she's been around doing prevention. She talks about doing stuff with Chris Davis, was just a prevention specialist. So she's been doing this for a long time, just in different capacities. She was at the University, Missouri State for a long time. And I think she was a health educator at another health department. So she knows the lingo.
I was amazed we had people from so far away.
Mm-hmm.
New Jersey and Nevada and Kentucky. I love their accents.
I'm really shocked. We had 47 people sign up and only 7, well, it's counting 4 in that one room. So 11 people showed up.
They're moving on to the next question. Don't do the new question.
Are they doing both questions?
Yeah, hold on. Let me broadcast a message.
Going to move on. It's 41 degrees here. I don't like that.
You're warmer than I am. There's no 4 in front of our temperature down here.
You're just 1 degree. I could not get warm yesterday. It was so cold in my house.
You want to hear something cool?
Yep.
So apparently up where I went to high school, they're having overdoses and stuff like that. And so they're at my old high school, they're having a community forum on substance use. And guess what video they shared? The SAMHSA one, the prevention happens here, that Angela and I did. They shared that on their school Facebook page.
Know your alumni?
I commented and I said that I was glad they were doing this. And I said, just FYI, there's an MB alumni in this video. Nobody cares. It's fine.
That's cool though. Yeah. What are they overdosing on?
I don't know. I didn't ask.
Did you hear about the place in Solyard, Missouri that was selling, it's like a farmer's market, the Delta 8 CBD, so it's like selling THC there?
Yeah, they are.
And THC companies like, so that's not fair, they're trying to get them in trouble. Because you can't stick together when someone else is winning.
They went ahead and did both questions.
Well, you've only got 40 minutes left, so it might be that you just combine those two.
Yeah.
It might also be that no one's got experience, so it went really quick.
Oh, well. Such is life.
The best laid plans.
Mm-hmm.
When does your plane leave tomorrow? Early?
10:26.
That's not bad.
Not super early. Yeah. Early enough, though, to drive to St. Louis and have to be to the airport 2 hours early.
Well, Chuck, did we put a bug in your ear when I said you should bring your camera down and we'll go down along the Buffalo and take some pictures?
I looked it up on the Google Maps. I can't believe I've ever been there. I've been on both sides of it.
You can go all the way from Beaver Lake, which is over by Eureka Springs, all the way over to what's the other lake down there that's east of there?
Yeah, and
it's all on the White River. There's all kinds of places you can see. There's a Bull Shoals Lake. There's actually the highway is flooded over, so you take a ferry from one side to the other.
When I was married, we did our honeymoon in Melville, Missouri, on the White River.
Yeah. So. No.
But that was a long, long time ago, but it was cool.
You ever want to wander around? I haven't been down there I don't think I've been down there since I sold my motorcycle. So that was 10 years ago.
That's big motorcycle.
Invite me. I'm ready to go. That sounds great. And there's a lot of Bigfoot sightings down there.
All right, here we
bring
come back.
Bring your camera with the telephoto just in case.
I'm not going to use the telephoto. I'm going to get up close and personal.
And we're coming back. All righty. Are we all back? We're getting back. Okay, cool. Do we have us all? Okay, cool. All right. You guys, you overachievers, you guys. Okay, so in breakout 1, who wants to talk about your experience with community needs assessment? Who's your reporter?
Well, I typed it, so I guess I can report. Just kind of what everyone was saying is a lot of us were pretty new to prevention, or, you know, we've had big turnover in our coalitions. So we have kind of like limited experience. Deborah has implemented a community needs assessment before. So we were kind of just listening to her and her experiences. And she was kind of talking about like having people participate and getting them into the rooms can be difficult as like one of the obstacles that she's faced. And like, for our coalition here in New Jersey, that hospital actually like runs the assessment because they have so many connections to all the different sectors. So they're the ones that actually run the community needs assessment versus the coalition ourselves.
Okay, thank you guys. And then our second group. So who wants to report about your experience with community needs assessment?
Well, I guess I will, since I typed it up. So we had some different levels of experience. Some of us had little to no experience, and then some had experience, but they wanted to learn more. They said they did some collecting. Another group said they collected data, but they didn't fill out every piece for it. And then we talked about the assessments and obstacles. So our assets were connection to the community partners and knowing who to talk to. Obstacles could be lack of connections, perceived ideas of what your agency does, getting the buy-in from the community. Maybe some people don't feel that you need an assessment, just do what I tell you to do. And not everyone's needs for the assessment can line up.
Boy, that's the truth. Yeah. All right. Good job. Okay, moving on here. We're going to dive into, so the first part of a community needs assessment is to define your community. And this kind of throws people for a loop when you talk about defining your community, because they honestly think, well, duh, I know what my community is. But it depends on what your group or your coalition is focusing on. Are they focusing on changing what is going on in like your town as your community, or are we looking at your county for your community, your school, or maybe it's just a specifically a business strip that is in a college town? I saw a presentation one time. It was in a college town and there was a strip of bars and they were serving underage youth, you name it. They had an issue with alcohol consumption, illegal alcohol consumption there. And so they defined their community as just that strip where all the bars were in town. So it really comes back to what is your focus when you're looking at your community. So let's talk a little bit about our scope. So these are some of the questions that we tend to ask when we're looking at what we want to focus on with our coalition. A lot of times coalitions form because something happened in the town. And so therefore, obviously, that would be the driving factor of, okay, now let's say underage drinking. Something happened around a youth party or something detrimental to youth within the community. And so now we're going to look at underage drinking. That's the easiest one because that's when I started into prevention, that's what I did, was youth underage drinking prevention. So that's what I'm going to focus on, just to use examples. So that would be our key issue. We want to know who will be affected by the anticipated change. And that does not just include youth. A lot of times when we think of changing what is going on in the youth culture as far as drinking or drug use or any other topic that you want to throw in there, we think about just implementing this with the youth. And the good thing is the one thing that we know about prevention is that it does take a community. And I'm not talking about the community which we just defined. I'm talking about parents, caregivers, teachers, business owners. It takes everybody, because a lot of times the youth specifically are just like, well, they're the ones that need to change. Well, do they, or does the whole community need to change with them? So really make sure that you keep that in mind too, as you're thinking about your scope. And then the other thing is a lot of times people in the community, someone mentioned, which it was a great segue, of maybe they don't know what our coalition does. Sometimes I think that we are kind of the best kept secret, and that's not what we want. We want to make sure that people understand what we do in the community. So do they understand the problem? Do they understand what the coalition does? So maybe one of your first things that you need to do is introduce your coalition to the community and maybe kind of get the word out about that. And then we look at the desired change and what is the outcome? Okay, we want to reduce youth alcohol use in our school, in our community, in our business district, whatever your focus may be. And then one of the last questions, and these are just a few that I pulled out. Obviously, if you've done any sort of scope work or goals and objectives, you know that you could go on and on and on. But I will say with that also, you want to make sure that you have some pretty specific obtainable goals, because otherwise you will spread yourself too thin. A lot of times, especially with coalition work, we do want to tackle everything. You know, we want to make the community a safer place for our kids. So this might require X, Y, Z, A, B, C, D, you name it. But we really want to make sure that we tackle maybe the most winnable one first. Maybe that's something that we want to put a feather in our hat and be like, awesome, that's great. We're building capacity. People are seeing what we're doing. And now let's go forward and tackle some more hard issues, if you will. Maybe some ones that might take a little more time, but that's something that you would have to decide within your group, and that's okay. And so this is what is going to guide the information that you need to gather from your community. And we will talk about this towards the end of the presentation, but this is very much, it's not linear, it's more circular. A lot of times you're constantly gathering data of what's going on. And that's not necessarily, it's no fault of the coalitions. Maybe something pops up or there's a new agenda that comes out in the community, and maybe you need to gather some data on that to see, do we need to pivot or do we need to make another group that maybe needs to focus on this? It's all these moving parts that they kind of look like cogs on a wheel, if you will. And so you guys kind of went through and talked about your assets and your obstacles a little bit. And so we will go ahead and do this as a whole with our group. So let's talk a little bit about when it comes to gathering data at your level in your coalition, what are some assets that you have available to you? And by that, I mean, who are the folks that you already have at the table, possibly, or you already have a relationship with, that it would be very easy for you to get input from? So who are some of those people? Can you guys just maybe shout out a few of those? Maybe not shout, sorry. Can you say a few of those?
The health departments, our local health departments.
Yep.
Our coalition members and stakeholders we frequently work with.
Mm-hmm. Mm-hmm.
You partner a
That
lot
should
with...
be.
Oh, go ahead, Alicia.
I was going to say that should be almost an expectation from the coalition members, is that by you coming here, we're going to ask you things and we're going to want data for you. It might just be input, but we're going to want that from you. So good point. I'm sorry, go ahead. What were you saying?
We work with other nonprofits who serve other members of our community that we might not directly serve.
Yeah, and that's a great way to gather some of that other data. Like if you're specifically substance use, say you work with like a teen dating violence coalition or some other group like that, that's another way to bring that data into your set. So we know that that's very much related. And then that's data that you don't have to go dig for because they already have it. Who else?
This is Webster County. You know, we're actively involved in a medication disposal project. And so we're working with the police department and funeral homes and healthcare people. We're out having conversations and getting resources into their hands right now. And so we're building that community with them and that collaboration with them. And if the next step were to be something on drinking and driving, they know we're invested in the health and safety of the community. We're building a relationship. They're invested in it. And so we both care about the same issues. So every time we make a step like that, we build stronger relationships and more assets in the community that we can reach out to.
Absolutely.
Any
other?
I'm sorry, Alicia. I would say local businesses that it's going to directly affect. So if you're talking about those bars, you know, what's it going to do to their revenue? What's it going to do with their image? Like if you were to blast them in the front of the newspaper and say something like that, that's not how you're going to get them on your team. But if you award them and say, you guys do a really good job carding or things like that. So kind of winning them over a little bit. But I think the businesses that are going to be affected is a big piece of that.
And you brought up a good point with that. Even the businesses maybe that neighbor next door that maybe wouldn't be open. So say maybe, for some reason a sewing shop popped into my head, but we'll use that. A sewing shop next door to a bar, maybe they get the litter and other unmentionable things that happen when the bar is closed in their front. They won't want that either. And anything that they can do to help partner with to make their storefront safer is something that they will want to do as well. So great point. Anyone else before we move on to obstacles? I always like to start with the positive first. Okay, let's go with obstacles. I know in Missouri, a lot of times are in the grand scheme of things. Oops, sorry. We had a problem getting into the schools unless you had a really close relationship with the schools, because the schools in Missouri were very protective of their data because they didn't want to look bad. And so our coalitions that got into those schools were the ones that had the relationships and said, we're not going to make you look bad. If anything, we will make you look better. So what are some other obstacles? Who are some problem children that we might have when we are trying to collect data?
I think collecting data from youth is sometimes tricky because we do have youth coalitions, but it's the kids who aren't using substances. So how can we talk to the kids who are possibly using, who are getting in trouble with the law? You know, the kids that are most affected by ACEs and things like that can sometimes be tricky to find those kids because they're not as involved as the other kids.
Sure, absolutely.
Well, something in Kentucky, we have really good data for like with KIT for our schools. So that's a Kentucky incentive something. Deborah, you might have to help me.
Kentucky Incentives for Prevention.
Yes, thank you. And so we get really good kid data, but adult data is so hard to get because you literally have to go to where they are, and 90% of the time they're really busy. And so they don't trust you because they don't know who you are. And that is one of the hardest things for me, I know, especially.
Yeah. Anyone else? All right, well, let's talk about the different kinds of data that there are. Quantitative is our first, and that's probably what I think that people think the most of when they think about data is the numbers, you know, because we're constantly, especially in the prevention field, we're throwing people numbers, we're gathering numbers, and we're looking at this in this way. So it is obviously a range. A lot of this stuff exists already. This data exists already. A lot of schools do school surveys. We have the YRBS, which is the Youth Risk Behavioral Health Survey, which is done at the national level, but they do break it down to states. That's where we use a lot of our data in our messaging and our campaigns and stuff like that that we do. And then there's other groups like we talked about that have their data as well. But this is something that you wouldn't necessarily have to do on your own. A lot of this is out there and you can find it, and you don't necessarily have to do your own number crunching if you don't want to, but it is definitely something if you have the capacity to do, or if you have a wonderful evaluator, which I would die without an evaluator. So we love ours, and they can crunch those numbers for you. And then of course the qualitative data. And this comes in the forms of interviews, public forums, observations, focus groups. I think focus groups and interviews are probably one of the most popular ones that we use. And Justa brought up a great point of, you know, here we want maybe parents who might have some youth that maybe teeter on those using or have used. Are we going to get those parents there? Are we going to find out what that adult data is if there's no sort of incentive for them to get there? So it's definitely a concern. I think it's been around since probably the beginning of time of prevention. So it's definitely on our radar all the time. But when we think back to what our focus was back when we first started and we were talking about what is the focus of our group. So there's two different ways that you can do this. A lot of times when you bring people together, and we touched briefly on this, you're going to see if, one, are you going to build your coalition? Do you need to inform them what the coalition is, what roles exist in the coalition, where they might be interested? That's one way that you could do a focus group. If that's already done and you've already built your coalition and you don't need anything else, you might bring a group of adults and kids together, and you might talk about substance use in the community, or whatever topic that you want to talk about in the community. Maybe it's vandalism, something like that. But those are two different ways that you can approach those focus groups. If you're just starting out, you might want to build your coalition and just have an informative focus group about your coalition and see where people lie there. Or if you're already built, go ahead and dive in and work further into the issue that you have at hand. So anytime it wants, there we go. Okay, so this is not a complete listing of different sort of data and or places that you could get them from. So obviously just straight demographics of how many people are in your community, county, state, whatever you defined as it. Highway safety data. I know here in Missouri, our highway safety data is holy moly. It will tell you whatever you want to know. We have a Students Against Destructive Decisions grant. And so we focus a lot on highway safety, and we pull all of our information from our highway patrol and their report online. And it's just a drop-down box, and you can put in whatever you want to put in, and age groups, fatalities, alcohol related, you can add all the little definers in there. Liquor law violations. If you have a liquor department, a liquor enforcement, department in your state, they have all kinds of violation data and licensing data and stuff like that. So get them on board. Alcohol sales is the same way. They will have what stores sell what alcohol and what percentage and what time, and you name it, they have it. We've already talked a little bit about the school data. Our criminal justice system have their own subset of data as well. And they break that out by youth and adults as well, and the different crimes that they are incarcerated for. The injury and death involving alcohol, those could come from either your highway department or hospitals as well. They tend to monitor some of that. One of the things that we kind of forget about sometimes is our treatment folks. They have all kinds of data when it comes to our youth and adults. And that's one place that I really would encourage you to go. Prevention initiatives, somebody mentioned earlier, other prevention initiatives that are happening in your community. It's a great place to start and to look at what data that they have that you can incorporate into the work you're doing. And then of course our youth, which we've already spoken about as well. And again, I put what else at the bottom because this list is definitely not complete. This is probably like this much of the data that's out there that we could look at. But again, going back to what your focus is will really guide you in where you go to get your data. And so here are some of, like, I Googled some of the ones like that I didn't know about. Obviously the ones at the bottom we already spoke about: health department, law enforcement, schools, hospitals, we talked about those. But some of these at the top are ones that probably are ones that we forget about a little bit. And quite honestly, I didn't even know about the KD Nuggets one, but when I Googled data sources, it popped up and it had quite a bit of data in there. So jot that one down and give it a Google when we're done. Center for Disease Control has a lot of data too, especially now with substance use, since they do have our DFC grants. That's where they're housed. They have a lot of that information as well. And then I wanted to show you, this is something that we developed. And Steve will be sending this out to you guys. This is something that you can do. This is underage drinking related, just FYI. And so what this is this is a community policy scan, like a little introduction that we created and what to look at for policy levels. And then it goes on to talk about what retailers can do and policies, colleges and universities. Sorry, I'm going to go through this one kind of quick just because we're getting low on time. But again, like I said, Steve will send this out to you guys after we are finished. So, but this is what I really wanted to hit for you guys to see, is this is just a fill-in document for some of this data that we were talking about. And you can see, there we go, the highway safety data, liquor law violations, alcohol sales. And again, if this isn't something like, let's think of alcohol sales, if this is something that your alcohol and tobacco control department doesn't have, these are good, easy questions to go in and ask your retailers to see if they have this data. And if not, just ask them for an estimate. You know, it doesn't necessarily have to be exact. It will give you a good idea of what you're looking at. Your school data, your criminal justice, injuries involving alcohol, treatment, prevention, youth. And then at the end, there are a few policies that can either be implemented at the local level or the state level. Again, like I said, Steve will send you this. It's a pretty exhaustive list. So feel free to use as you wish. Let me look in the chat real quick. Okay, Steve's just giving updates. I was making sure I wasn't missing anything in the chat. Okay.
Alicia, it was asked, and so I don't forget.
Oh, yeah.
Can we make your slides available also after this?
Absolutely.
Okay.
Yeah. All right. So then, now that we have our data, we have it all. We did it just like that. Boom. Now we're going to analyze it. And I know that everyone's heard of a strength, weakness, opportunity, and threats. Again, this isn't anything that is fancy pants. You just, I again, like even before we hopped on, like over lunch, I Googled SWOT and boom, everything pops up and it will just give you this nice little diagram on how to plot your strengths, your weaknesses, where are your opportunities, and where your threats are as well. I know for underage drinking prevention, a lot of times getting those retailers on board or the alcohol distributors is really rough. But again, and it's a whole nother training, but we can go into that relationship building and just how does it benefit them? I think someone said that at the beginning, just making sure that they know how it's going to benefit them and get them on board in that way. So then putting it all together. Obviously, this is the time that maybe then we work into, now that we have the data, then we start talking about our plans and what we want to do and some of the policies and or campaigns or community events that we want to do. This is where kind of the rubber hits the road now that you've started with all of your data. So that is a nutshell when it comes to this. So yes, absolutely. I will make all of this available. Steve will send it out to you. What questions do we have? Like I said, that was the 10,000-foot view.
I think I'm most interested in, it's like, so we collect all this data and we do this community needs assessment, but then how do we, you know, I know it's always like a huge document. How do we then communicate that back to the community of like, this is what's going on here?
Mm-hmm. And in my opinion, I think you pull out your top 2 or 3, because again, you don't want to overwhelm your community with, okay, look, we have 12 to 15-year-olds doing this. We have 16 to 8-year-olds doing this. We have 21 to 25-year, and I don't even know if you'll go up that high, 21 to 25-year-olds doing this. Don't overwhelm them with the data, because I don't know about you. Like I can look at data and I'm like, this is too much. I am now completely overwhelmed. What you need to do is you need to pick out your top 2 or 3. And again, think back to the beginning when we talked about what do we want to focus on? Do we want to pick something that is an easy win, like I said, to start with? Or do we want to just dive into the hardest problem that we can think of? And that's it. That's all we work on. So whatever your coalition decides, that's what you should extrapolate and then communicate that to your community to get their buy-in. Does that make sense?
Yeah, absolutely. Thank you.
Okay. It's biting one shoe at a time or going up a ladder one rung at a time. Because I think that's the thing. And I think I kind of alluded to this a little bit, is in the field of prevention, we're like, okay, we have all this stuff to do. Let's do it all. Let's make all this change. That's great. We definitely want to, but we've got to make sure we do it one step at a time. Otherwise, we'll get overwhelmed. You guys will get overwhelmed. The community will get overwhelmed. The coalition will get overwhelmed. What else?
Alicia?
Mm-hmm.
Also, the way you present the data is going to be different for different groups in your community. Some people like hard data percentages. Other groups that you might talk to can give the same data with anecdotes and stories.
Yep.
So to get your community buy-in, you have to find out what their best method of receiving the information is. Because if I went to a meeting and just got data, I would blank out. But stories and anecdotes make a difference. So you have to determine that as well. Thank you.
Yeah, we worked with Dr. Jeff Linkenbach at the University of Montana, and he always said that story trumped data. So he always said that community stories were more powerful than like the actual numbers. And so he always found the way to weave them in. So just think about that as you're doing data too. You can definitely take a story and then weave in the data that you want behind it.
A question that I have is, if you're not working with a coalition, but you're doing this for your own company, like, because I'm working on one about the trainings that people are invested in. And so do you have any strategies for a one-man coalition that's working towards this, or what?
So then are you collecting data to justify your trainings? Is that what
to see if we need to get more, to see if funding needs to be funneled more into that realm?
Okay, so you're kind of looking then at kind of the capacity of your, I hate to say workforce, because I don't know if we're talking workforce, but
yes, workforce.
I'll use that term. Yeah. So you're looking at the capacity of your workforce. And so that's a little bit different when talking about workforce development. That's probably a whole nother training, actually. But yes, you're definitely looking at then what your needs are to be able to conduct your job, and where the gaps are with that.
Okay. And so would that be considered? Well, is this considered a needs assessment? Because I feel like it is, but it's not either.
Yeah, because it would be the needs of your workforce and what they are missing as far as being able to effectively complete their job.
Right.
Yeah, right. Absolutely. Yeah, that's the best thing about a needs assessment. You can apply it anywhere. Business, not-for-profit, coalitions, healthcare. Yeah, you can apply it anywhere.
Right. Thank you.
Hopefully that was helpful.
Absolutely.
All right. Any last questions? We still have a few more minutes. So if you want to go 3 minutes early, that's fine. Steve, do you want to talk about the survey again that you put in the chat box?
Absolutely. So thank you, Alicia. Appreciate you taking the time to share the presentation with us. Thank you, everyone, for being here. I would like to draw your attention to at least the link that I've put into the chat. It's the last one that's most recently entered. It is what we refer to as the GIPRA. And it's totally anonymous. It's 6 short questions. We'd love to have you click on that and fill it out once the training is complete. I will also send Alicia's PowerPoint deck and the toolkit component that she shared with you during the training, along with the link to the training, once again, to take the survey. We'd love to hear from everyone. And it sounds like I heard Alicia say at least twice during this session, that's a whole other training. So it'll give us something to think about on vacation. Is that something from our audience while we're here? Is there a component of what we've discussed today that might be something we could elevate in a follow-up presentation to today's discussion? And if so, let us know that.
Yeah.
I mean, I think so. I think what you've discussed can be expounded on, and so I would be interested.
Maybe in the email, Steve, when you email out to them, you might ask them what different topics they would like expanded.
Okay. Deborah, did you have a comment?
I was just going to say, yes, I would love for every step to have maybe its own bit of time just to delve deeper into it, because I love the overview. That was really quick and simple, and it made sense, but then I'd like to get into some of the deeper parts of it, the steps.
Bring it down to the 100-foot view.
Tanya says that she agrees with that comment, so we'll look into that as the future.
And then get right in the pit with us. That's what we need.
All right. Anyone else? Well, thank you again, Alicia. Appreciate the opportunity. I'm glad that everyone was able to join us today. Look in your inbox later today or first thing in the morning, and we'll have that slide deck also along with the, if you don't take the chance to do the GIPRA survey today, and we'll send along that toolkit component that Alicia also talked about. So thank you, everyone, and I hope you have a wonderful day.